Welcome to tutorial number 7, where we're going to discuss the patient's diet. So how do you determine your diet? Or how do you determine your patient's diet? Again, we test, we don't guess. But a lot of people tend to guess, even doctors. They'll try to guess what kind of a diet the patient should be on. And what we want to do is we want to be a little bit more specific or more exact than that. So we use a process called metabolic typing to determine the perfect diet for you or your patients. And the quest for metabolic typing is to determine the state of balance or imbalance, efficiency or inefficiency of function between the sympathetic and parasympathetic nervous systems and all glands, organs, and systems that they control. That is our purpose, is to balance the autonomic nervous system, both the sympathetic, parasympathetic, biochemically through nutrition. Powerful statement. Now, the autonomic nervous system normally utilizes the sympathetic nervous system to speed things up, but this may not always be the case. Due to the receptor gates and neurotransmitters they secrete, they can affect different organs and glands in different ways, speeding some up and slowing some down. The sympathetic nervous system controls the neuromuscular, cardiovascular, and reproductive systems. It has a tremendous exerted force on those systems. The parasympathetic nervous system is usually responsible for slowing things down, but again, this is not always the case as mentioned above. The parasympathetic nervous system is responsible for creating and maintaining the body's energy supply by exerting control over the body's digestive and immune systems. So, since each gland in the body has dual innervation, receiving stimulus from both sympathetic and parasympathetic nervous systems, each system then is in direct opposition with each other and should be in perfect balance. If this does not occur, balance cannot be achieved and all physiology will be affected. In fact, the sympathetic and parasympathetic balance is necessary for the acid-alkaline balance in the body. To sum up, the autonomic nervous system directly affects all organs and glands, and because they affect acid-alkaline capabilities, acid-alkaline levels can be affected by the autonomic nervous system as well. In metabolic typing, you are trying to find out if the patient requires more acidic diet or a more alkaline diet. Once this is determined, you will give the proper nutritional profile, acid or alkaline forming foods to balance the acid-alkaline condition, thus restoring health back to your patient. On the next tutorial, we'll explain a little bit more about metabolic typing and how our program utilizes it and how it appears in the patient's report. Until then, have a great day, and I'll speak to you soon.